Welcome to Disrupting Japan. Straight talk from Japan's most innovative founders and VCs. I'm Tim Romero, and thanks for joining me. Japan has one of the longest-lived populations in the world. And as you get older, well, you start thinking more and more about getting older. Of course, getting older is much better than the alternative, but we all want to slow it down a bit and do it in a healthy way. Now, those of you who know me won't be surprised to learn that once I got interested in this topic, I got a little obsessive. I have a smart scale and a smart watch and a smart ring, all confidently telling me slightly conflicting things about the state of my health. And anti-aging startups are a mixed bag at best, ranging from difficult, boring, but very effective medical advice about diet and exercise to fun, cutting-edge wearables and trendy supplements and treatments that are a complete waste of money, and everything in between. Well, today we sit down with Bilal Kharouni, the CEO of Ekei Labs, who's going to help us make sense of all this. Now, the Ekei Labs journey and their pivots while trying to find product-market fit in the anti-aging market is really a microcosm of the whole wellness industry, from supplements to consumer-facing tech to medical research to, well, I'll let Bilal explain where it all ends. Now, interestingly, Bilal and I had this conversation in Okinawa, home of Japan's longest-lived population. And we talk about finding product-market fit in health tech, how to sell to Japanese enterprises when your Japanese ability is limited, and how Japan's new visa restrictions are going to impact startups here. But you know, Bilal tells that story much better than I can. So let's get right to the interview. I'm sitting here with Bilal Kharouni, the founder and CEO of Ekei Labs, who's selling direct-to-consumer longevity testing and support services. So thanks for sitting down with us.
Yeah, thanks for having me.
Now, you're based in Tokyo, but we're sitting here in Okinawa today. You've recently joined the OIST incubator. So tell me about that.
Yes, we work on aging and longevity. So for us, there's not a better place than the blue zone of Okinawa to really sit our lab and working on aging. Actually, we pivoted quite a lot from direct-to-consumer longevity tests. So we really have a platform that is more intended for joint research. We went much further in terms of research, so having both the lab and the talent and also the perfect location to...
Well, I mean, Okinawa famously has one of the longest-lived populations in the world. Is that coincidence, or does that inform your research in some ways?
So it's pretty coincidentally, I would say. The reason we hypothesize why Okinawan people live the longest are part due to diet or social activities, being surrounded by their loved ones, which is great. But what we're investigating is mostly therapeutics to increase healthy lifespan. So it's much more in the deep tech zone, I would say. However, for people who have an interest in longevity and living longer and who wants to work on these topics, it's a very attractive location. And it's an attractive location for hiring some of the best people. We had the chance having members quitting their job from Tokyo to join us in Okinawa to work with us.
Well, I can certainly see the appeal of coming to work here. So let's talk about biological age, because this is something that fascinates me. But what exactly is it? Like my smart scale at home tells me about biological age. I think this wearable also will give me a biological age. But what exactly is it?
So it's a very interesting question, and that can be quite confusing for many people because, as you're mentioning, you have so many different biological age for one chronological age.
Yeah.
So it's really looking at a spectrum. So that can be, for example, your cardiovascular health, your fitness, or any kind of biomarkers, and see how you benchmark compared to the rest of the population. So you might be 32 years old, but for example, your VO2 max might correspond to a healthy individual of 18 years old. So you could say that your cardiovascular health is of someone of 18 years old.
But is it something that is scientifically defined? Is there like an accepted way to measure these biomarkers and calculate it this way? Is there an accepted scientific consensus about how to calculate it?
There is not a scientific consensus yet. And that's actually a big challenge in our industry. We have different ways of measuring biological age, using, for example, epigenetic marker, glycan marker, proteomics. And the big question is which ones have a clinical translation. Because I can give you a biological age, but if it doesn't mean anything in terms of risk of disease or physical conditions, it's frankly a useless metrics.
I'm also curious about, okay, not necessarily the way you calculate it specifically, but industry-wide. So when biological age is calculated, is the actual chronological age always used as an input, or can it be calculated independently? Or is it more of like an adjustment factor?
So when you do the algorithm, you have a data set with the metadata set with the gender, age repetition that helps calibrate the biological age. And ultimately, you would want, when you take an input from a patient, not knowing the chronological age, and estimate just the biological age independently of the chronological age. And industry-wide, there are different clocks, and now there's a huge work for having this clinical and scientific validation. So each year, actually, I'm going to Boston in October for the Biomarkers of Aging Symposium that takes place at the Harvard Medical School. So that's really ongoing discussions in the field.
So your offering also involves a mobile app, right? This app provides insights and advice on how people can improve their biological age. So what kind of insights and what kind of lifestyle changes does it recommend?
So for the app, low-hanging fruit for someone like the diet, sleep, physical activity. And we put this app for use for clinicians, and they can be also very helpful for the clinicians to have both a biological age metrics as well as information on the lifestyle of their patients, because it can be quite difficult for the clinics to know how well the patient eat or sleep, and then the medical doctor can really guide the medical journey to help them in their longevity medical journey.
So what are the biomarkers you're looking at? I mean, you've recently been selling like a home test kit for that's like a blood sample. So you've got the blood test, and what other information goes into the calculation?
So we have two types of product services. So the one that you described is for individual use, and we use a biomarker called IgG glycans. And what is amazing with this biomarker, it is that it's very responsive to interventions. An intervention of 8 to 10 weeks and do another test, you can see a delta, you can see a difference in this biomarker. And what is also great with this biomarker, that is extremely linked with chronic inflammations. And chronic inflammations are linked with a myriad of chronic disease.
That's really, so is that like just a coincident marker, or is that actually directly related to biological aging?
That's a great question. Menopause is probably one of the conditions that is most linked to biological aging. And when we see that so many times is misdiagnosed and mismedicamented. So having ways of getting the early signs through this IgG glycans measurements, and then having better medication or better health optimization or better response from the medical doctors, we think is extremely important. And probably the first longevity drugs that we could see on the market will be a drug targeting menopause and perimenopause. That might be one of the first age-related conditions that we might be able to treat one day.
Excellent. Let's take a step back for a minute and kind of talk about how Ekei Labs came to be and how we ended up in this room having this conversation. So you actually launched in 2019 with a completely different business model, selling supplements. You relatively quickly decided to pivot on that. So walk me through like how that happened. What was the story there? What was that like?
Absolutely. So with my co-founder, Mehdi, we were facing the topic of longevity around 2016, 2017. He was then finishing his thesis at Keio University, and he had some first insights on clinical trials on humans with NMN. And 2018, I quit my job and I just went full on.
Even back in 2019, your goal was to focus on biological age measurement, or?
So in 2019, what we wanted to do, it was consumer platform system that other company has launched, where you have like regular biological age testing for consumers and then supplements, and then you could do like personalized dosage depending on your result. That was like the first concept of Ekei Labs. And then we pivoted to really focus on one thing. So we chose measurements. You need to measure something well first before being into managing it.
I misunderstood. My understanding was that in 2019 you were doing just the supplement sales.
Yeah. So actually, like the supplements, we had like some prototyping, and then COVID hit, and it put like the operation on pause for a while.
Okay, because I mean the supplement market it's fiercely competitive.
Yeah, it's fiercely competitive, and also it's always the same problem. The clinical validation and the scientific validation are not always here. And same thing also for biological age measurement. That's why we took another step back. And
actually, I'm curious though. So the supplement market is an interesting one, both for enterprises and for entrepreneurs. For example, in the US, the supplement market is very, very lightly regulated. Mm-hmm. There are certain claims you can't make, but you have to kind of imply, and then all is good. What about the Japanese market? Is it similar to the US, or is it pretty tightly regulated here?
I would say it's pretty tightly regulated. So you have an appellation called food with functional claim, where you have several claims that are either already listed and proved, and then you can put these indications on your supplements. Or if you want to create a new claim, you need to have a really solid clinical data.
How did you go to market under that regulatory regime, where you couldn't make any kind of explicit claims about longevity or benefits, or could you make claims about?
No.
So how did you market them?
So the idea was, so NMN is derived from niacin. So niacin is already highly documented. So we could have similar claim, or we could have general claim, good for wellness or good for general wellness. But you cannot have any claim related to aging. You cannot say, for example, good for healthy aging.
So that can make the marketing difficult.
It can make the market difficult, but also I think it's a good safeguard for consumers to not be misled with the interventions especially in the early days. So what motivated us actually to launch an NMN company was that the price for NMN products in Japan were extremely expensive. I'm talking around 200,000 yen for a bottle.
Oh my God.
Yeah, it was extremely expensive.
Was that just because demand was so low?
I think demand was so low, and then you had like one company who was distributing it. It was really like the early days, and they had this premium marketing. And our idea was, we're in connection with the laboratory in China who were like producing NMN for clinical trials and for academia, and we knew the price, and we knew that there's no way it would cost 200,000 yen for a bottle. And yeah, but that's the thing, if you have no safeguards, you can have, I think, like predatory behaviors of people selling interventions that are not clinically validated, scientifically validated, with false claims at a pricing that can be predatory. And that's definitely not at the advantage of the consumer.
So after the supplement business model, I don't want to say fall through, but
yeah, that's true.
After the supplement business model fell through, you decided to pivot to direct-to-consumer anti-aging testing kits, right?
Absolutely. So that was really the idea. We wanted to think, okay, there's some scientific and clinical validation for those biomarkers, and it can be a good validation for consumers of what they could improve in their lifestyle. So many of my friends, for example, are going to be very healthy for a couple of months, but because they don't see an actual result in the mirror, they don't see an actual result like on their phone, they can really give up being healthy in a very short period. So we thought that the biological age metrics could be a great motivator for people to keep being healthy for longer terms.
Yeah, I love the whole concept of kind of gamified health, nudging yourself into better habits and better behaviors. I think it's good business and good for society as a whole. But in some ways, it seems like the direct-to-consumer testing is sort of similar to supplements in that it's lightly regulated. And as you mentioned, there's no real definition of what biological age is.
Yeah.
So did you face the same type of regulatory restrictions about your claims as you did during the supplement era?
So in terms of regulation, so aging is not a disease. So we cannot diagnose aging as a disease. So there's a way for market entrance that is pretty easy, I would say. In terms of challenge that we've had and why we pivoted from D2C was more the value we can actually bring to the consumer in Japan. What is the interest for a Japanese consumer to pay hundreds of dollars out of pocket for a test when there's already Ningen-doku, Kenko Shindan existing, and such a strong healthcare system?
But even looking at the test kits as anti-aging, I mean, medically it's not a diagnostic device, so that makes sense. You're under much less regulatory scrutiny. But from a consumer point of view, from a marketing point of view, my impression would be that when people are ordering these kind of test kits, they're not trying to diagnose a disease or something. They're trying to get more of a general sense of their own wellness, right? So does that necessarily compete or run up against the Ningen-dok and the health insurance program here?
In some way, I would say so, because the idea, like when you want to know your biological age, if it's higher or lower, you want it to have been information about your health in general. And also because what we measure is related to chronic inflammations. That's also really linked to the potential of the onset of certain chronic disease. So in a way, I would say that it's quite competing with the existing health infrastructures.
Yeah, I could see that. There certainly is that overlap,
yeah.
right? Getting back to our earlier conversation about having like no scientific consensus about what biological age is. So there are lots of different home test kits and wearables and scales all telling us our biological age. Are any of these like benchmarked against clinical trials, or how do people come up with these numbers? How are they verified?
So the first person who really introduced a solid and technically validated biological age clocks was Steve Horvath in 2013. So he looked at the epigenome, the gene expression layer that is regulating gene expression. And he saw some patterns on which genes were regulated or not by measuring the methylation on the DNA. And he noticed that those patterns were not random. They actually correlate with age. And that was the first time that we could think, okay, maybe this biomarker could be a great interpretation of the biological age. So that was the first biological age clock in 2013. And it was actually very correlating with the chronological age. And then we are now at the fourth generations of biological age clocks. And the idea is to find markers, for example, in the epigenome, that correlates more with the onset of disease and the cause of aging, more than correlating really with the chronological age.
The science is fascinating. Yeah. And long term, I think the science is clearly important. But there's this gap between the science and the direct-to-consumer products. So certainly during COVID and after COVID, there's been this explosion of direct-to-consumer test kits for all kinds of things. And, none of them are diagnostic devices. And I'm just curious, with the science at such an early stage and moving so fast, how do these test kits in general test for accuracy? Do the manufacturers self-test? Is there some sort of governing body? Or
yeah, the large majority of those tests have academic publication. And the ones who don't have academic publication should be avoided at all costs. But there is an academic publication, and there is a peer review work, and there is collaboration, and there's an outcome of academic collaboration.
Well, I'm not talking about the academic use. I mean, I'm talking about the pure direct-to-consumer sales.
Yeah, exactly. So they use algorithms that have been peer-reviewed, and there is academic publication. So they don't come from out of nowhere, and you can read the papers on Nature for both of them and look what was the data sets, how they correlate with certain disease. So there is this academic background and rigorousness to consumer kits, even though we know that those markers, for example, can correlate with aging or certain disease. The clinical translation is not as evident as it is right now, and that's why it is a big topic on our fields now. How can we use those clocks for clinical translation and actually improving the health of the consumers or the patients?
Okay, that makes a lot of sense. So with the kind of the strict regulatory regime in Japan and kind of the limited appeal of these kind of home test kits, you decided to take the company through a third and most recent pivot, which brings us back here to Okinawa.
Yeah, the line of thinking is actually quite similar of the LMN. First, we saw a market, we saw pricing, and we thought like, okay, how can we do it ourselves and decrease the price? So we were very interested in epigenetic testing, and we have a team members who are really experienced in next-gen sequencing and biology of aging, who are very experienced with those methodology. And we managed to build our own proprietary methods to do DNA methylation sequencing at a much higher resolution and lower cost than the industry standard technique. And we realized that the value of having these high throughput, high resolution methods were not so much for consumers, but more for the researchers. And we're collaborating with R&D institutions who want to have this data from their own samples to accelerate their research.
So your current customer base is research institutions, or does it also include things like pharma companies?
So all of our revenue now comes from private institutions and R&D departments of larger groups, as well as biotech startups.
So it's still squarely focused on longevity.
Exactly. So ultimately, our methods could be used in any area of life science because many areas of life science are interested in getting epigenetic data. But our focus and specialty now really relies on companies who want to have a target for aging on the market in the coming years.
You know, it's kind of interesting in a way that every university in Japan is working to try to figure out how to commercialize their research. And you've kind of inverted that where you sort of had the market first and backed into doing the research and funding the research.
Yeah, we really went from like the most thing that can be available for the consumers and stepping back to now doing fundamental research in clinical trials to try to find new interventions.
So let's talk about your long-term go-to-market and your long-term business models. Yeah. So do you plan to establish yourself and grow as an independent research organization? Do you plan to eventually move into medical diagnostics and clinical trials? What does the future look like? Yeah.
So now 95% of our revenue comes from B2B. So it took us around 2 years of R&D to have this epigenetic research platform operating. And we've had a lot of great commercial tractions. We're now processing thousands of samples. And how do we make money currently is we make money for each sample that we sequence using our methods. And for some clients, we also propose custom AI model. We have a very talented team member, and we can also make money by delivering those dedicated AI model, not built on noisy, publicly available data, but on the high throughput, high resolution data that we're going to sequence from the sample of our clients to make sure that the data set is really pristine and for the unique phenotype of our clients.
So AI is always exciting, but won't this eventually face the same challenges you faced with the supplements and the direct-to-consumer testing, where to have real scalable value, it needs to get either certification as a diagnostic tool or isn't there sort of that natural ceiling in the market?
For the research, actually, we've seen great examples of research departments using those biological age clocks to guide the R&D and actually finding great potential gene target, for example, for rejuvenation. So there's been very exciting progress by using those AI models to guide the R&D. So that's why we're very excited of being in this field. We think that now the clinical validation of using these clocks for patients might be a bit early and we still have some research to do. But using those models for longevity R&D is actually very promising, even for in vitro research. And this is where we are mostly interested on collaborating, really doing the fundamental biology and early work to find aging targets.
The whole longevity field is still relatively young.
Yeah.
At least this generation of it. But how long do you think it will take for what you're doing now to move from the research stage into the commercialization stage?
So that's a great question. In terms of indication and market accessibility, we work with very large companies who have pipeline for product that might be found in every company in 3 to 5 years. And on the other side of the spectrum, we work with very cutting edge startups that are working on gene therapy or stem cell therapy. So there's quite a large spectrum of interventions that are being investigated.
For an R&D business model, that's great news and really exciting. But as a consumer-facing or even a scalable product company, are you planning on like co-developing products with these companies or sharing IP? What's the long-term plan?
So the long-term plan for us is having a platform model. So now we make money piece for service on one side with a wet lab, with the samples, and then with a dry lab, with the licensing modeling that we are moving forward to. We want to productize our wet lab. So we're identifying compounds that we could patent and manufacture it for other companies to replicate our great data without having to send us samples. So we could send them a kit and then they could just basically plug it to the sequencing machine and then reproduce the same quality of data. And for the dry lab, what we want is licensing best-in-class models that we're working on. And those models will be trained on the data that we produce, which means that it would work hand in hand. If you would want to use our best-in-class models, you will need to use our platform to use it and then purchasing a kit. And that makes things much more scalable because now we're limited by the amount of people that we can have in our lab to receive samples and to treat them. But if we have this productization and licensing, then the scalability is much higher.
Excellent. That makes a lot of sense. Let's talk a bit about Japan and foreign founders in Japan. So you were actually the first foreign founder sponsored by Shibuya Startup Support.
Yes.
And you work closely with La French Tech.
Yes.
And as a new arrival, you have a better understanding of the situation than I do. What are some of the most important things that people need to understand when moving to Japan to start a startup?
That things can take longer time than in other geography.
What accounts for that? Is it just these Japanese customers are notoriously slow at making decisions, or are there other structural problems?
I would say it's mostly culturally, and you need to have this relationship of trust that is very important. And if you haven't graduated from a Japanese university, if you don't have the traditional ways of socializing with Japanese individuals and Japanese decision makers, well, you have to do the field work and build this trust, and it takes time.
So how did you build that trust?
So we had the chance of being in a very hot area, longevity. Many large companies and many researchers are very interested in what we are doing. So very early in the creation of our company in 2022, we've been talking with decision makers in very large companies or large organizations, and they've been just following our progress for a long time.
So it's just making those contacts, keeping them updated, letting them see you're making progress.
Yes, exactly. And also what I would advise, and that's also because also that's kind of the case in biotech, but also that's kind of like the concept of the POC, proof of concept, that's very popular in collaborating with corporation, is going to monetization as soon as possible. Yes. To really show that first you can be trusted, and also creating a commercial relation with someone. And I think that the relation with a client in Japan is really beautiful in a way, because it's really create a strong bond,
Yeah, I think that's so important, and it's something that a lot of founders overlook with proof of concepts, in that most POCs don't really lead to anything. You need to keep your eye on kind of the long-term ball. It's like, are we establishing a long-term relationship? Is this going to be a financial relationship moving forward?
Yeah, absolutely. I think that giving updates and having a floating relation with the decision maker is good, but having this bound of really working on something together and having them entrusted you, even if it's a small amount of money, completely flips the relation, and it's a great way of building a deeper relation. And in our case, led to great business.
So you don't speak Japanese, right?
Not as good as I should.
So what advice do you have about growing a startup when you don't speak Japanese? Yeah. I mean, how do you do sales? How do you build partnerships?
So first, it's spend more time studying Japanese. I think that's
it's a hard language. I mean, I've been here over 30 years. I still study a little bit every day.
Yeah, I got a bit confidence. And I stopped studying for a while, and now I'm just opening back my kanji book and studying again, because it's just so easy to forget. But yeah, no, I think that no matter what, speaking Japanese is important, and spending some time learning it is important.
But if you're on a 2-year visa, there's only so much Japanese you can absorb in that time.
True. So that's why I think like just making the best, to have a bit of time to just learning some Japanese every week can be meaningful. But also what helped us the most in our case was very early on having advisors or having a team of Japanese people that could just really help us both get the cultural clues or getting the cultural context to do business in Japanese.
So how did you recruit those advisors? Was that something that Shibuya Startup Support was helpful with, or French Tech? How did you connect with those people?
So before moving to Japan in 2022 with a startup visa, I actually spent quite some time in Japan. So I already had quite a strong network of people who could support us. Yeah, and then just being active, like I think like just naturally by building your startup, you just end up meeting people who are interested in what you do, and then it's all about the CEO job to charm them and having them.
Well, they say 90% of success is just showing up, right? So just being there, talking to people, letting them know what
Absolutely.
you're doing.
And that's why I think it's very important to really be passionate about the problem you're solving, because naturally you would encounter people who are also passionate about the same problem and who would want to join you, and then you can really move forward.
Actually, that really resonates with me, because what I found, especially, so all of my startups have been enterprise software. So I'm used to selling into the enterprise. And if you go into a sale with like an abundance of enthusiasm, most of the time it'll fall flat. Most of the time you'll be across the table with people who have no expressions and you'll get no questions. But every once in a while, you'll get that one person who is just as passionate as you are, but he's stuck inside this big company and he sees you as like, yes, this is what I've been wanting to do, and he will become your champion.
Mm-mm-mm. So yeah, it's really this, and we have the chance with the longevity field is that, especially in Japan, that's one of the reasons we are here in Japan, is because it has a really long culture of rejuvenation therapeutics. Most notably, the Nobel Prize of 2012, Dr. Shinya Yamanaka, really opened the path for cellular reprogramming. So for example, all of the companies in the US that make like really the headlines, Jeff Bezos putting 3 billion in Altos Labs, Sam Altman with retrobioscience. The common point is working on the Yamanaka factors, and it's originated from Japan. So you have a lot of Japanese individuals and decision makers who studied biology, who are very passionate about this question. There's really a very strong culture here in Japan.
Is that research continuing, or was it more of like inspirational to lots of other researchers who pursued it?
So now there's a lot of the research is pursuing, for example, to find safe dosage. Other people are finding other factors that are linked to the Yamanaka factors, but that can be safer or having other ways. For me, it's one of the most interesting fields. And there are a lot of also startups whose former students of Professor Yamanaka. So there's really a very strong ecosystem around this technology and these achievements.
So over the past month or so, Japan has really been tightening up its visa restrictions. How do you think that's going to affect foreign entrepreneurship in Japan, or entrepreneurship in general in Japan?
My honest opinion is that when you're a foreign entrepreneur, you remain an immigrant, and then you're part of the most fragile part of the population somehow. And then, unfortunately, you face those changes, sometimes it can be brutal, about visa restrictions or like anything else. I just see it as a part of the job, a part of the condition. It's unfortunate, but that's just being an immigrant in any country of the world. But I just feel like it wouldn't change much. It's just a new regulation.
So not much of a long-term impact one way or the other?
I don't think so. I think that is just another box to check. It went from 5 million to 30 million. It is consequent, and maybe like some businesses are not aware might be impacted by this if the capital cannot be sustained. But I just feel like it's just another box to check.
Yeah, I agree with that to some extent. I mean, founders are problem solvers by definition.
Yeah.
And in growing your startup, that's not even going to be one of your biggest problems.
That's what I'm thinking. So, and also I feel like this is not a Japan problem. I just feel like in any geography, in any market, in any territory, you will have some administrative issues coming up out of nowhere. So this time it's the visa requirements were different. You know, in other markets, maybe something different. It's kind of how I see it. It's just part of, part of the job.
Part of founder life.
Yeah.
Well, listen, Bilal, before I let you go, I want to ask you what I call my magic wand question. And that is, if I gave you a magic wand and I told you that you could change one thing about Japan, anything at all, the visa regimes, the way biotech is regulated, the education system, anything at all to make it better for startups and innovation here in Japan? What would you change?
I think it's something that many people would want, but I would say a stronger yen to be able to have wages who are more competitive internationally, to keep talents in Japan and to attract talents out of Japan.
Have you had challenges trying to get people to come to Japan to join you?
We're lucky enough that our collaborator from overseas is passionate about what we do, fully a believer of a product, and will move from overseas to Japan. But I can see it be a challenge proposing salaries from people in Europe or in the US for biotech position, because we're planning on accelerating our growth in the next couple of years. So I'm already preparing the hiring part. And yeah, I can see it being a challenge when you just compare the salary dollars to dollars. And also I see more and more talented people in Japan who can find position overseas.
Yeah, I mean, salaries in San Francisco can be double what they are in Japan. And so, yeah, that can be tough to compete against.
Especially if people don't know the quality of life you can have with a salary half the one in San Francisco.
Yeah, it doesn't feel like half, that's for sure.
Exactly. I mean, personally, I'm a true believer first of the Japan ecosystem. I think that a lot of great research, a lot of great innovation will change the world coming from Japan. On one hand, on the other hand, I just love living here. So I'm fine with a weak yen. But ultimately, down the line, I can see it being a challenge to being really competitive for talents worldwide.
Yeah. Well, Bilal, thanks so much for sitting down with me. I really appreciate it.
Thank you.
And we're back. You know, unlike most other startup sectors, the primary driver in today's boom in age tech startups is not new technology or a recent change in market dynamics. It's simply disposable income. Selling wealthy people the promise of long life or even immortality has been a solid business model for at least the last 2,500 years or so, since the quest for the elixir of life first began. Of course, that doesn't mean that there's no meaningful innovation or that startups do not have an important role to play. Clearly there is, and they do. Ekei Lab's series of pivots through the age tech sector just so perfectly show the avenues and the challenges of a small startup trying to make both a profit and a meaningful contribution in this space, starting out in mass market supplements and ending up in supporting the advancement of core medical research. And as the very first recipient of the Shibuya Startup Visa, Bilal's advice to new founders is excellent. Putting time into relationship building and keeping in touch is critical in Japan. Potential customers will stay on top of your updates, looking for signs of progress and of market validation. But never forget that this is a sales process. Your keeping in touch is not strictly social. You need to be moving the conversations to a close. The progress you share with your prospects needs to be focused on overcoming their objections, and every meeting needs to be framed in terms of your future business relationship. You need to get the ball in the goal. And the fact that Bilal and so many foreign founders are managing to do this with limited Japanese ability is truly impressive. And it should be encouraging to every foreign founder in Japan. If the problem you're solving is hard enough and important enough, even the most conservative Japanese institutions will be more than willing to meet you halfway and to work with you to solve their problem and to grow your startup. If you want to talk more about medical and age tech startups in Japan, Bilal and I would love to talk with you. So come by disruptingjapan.com/show245 and let's talk about it. And if you enjoy Disrupting Japan, share a link online or just, tell people about it. Disrupting Japan is free forever, and letting people know about it is the absolute best way you can support the podcast. But most of all, thanks for listening. And thank you for letting people interested in Japanese startups and VCs know about the show. I'm Tim Romero, and thanks for listening to Disrupting Japan.